And welcome to the Dr. Bob Show. How often do you hear somebody say, oh, my back is killing me, I've got low back pain, or I've got neck pain, my neck is stiff? Could it be a disc that's herniated? What is a herniated disc? What is a disc? What does that mean? How does it cause pain? We'll be spending most of this show talking about low back pain, neck pain, herniated discs. My guest is Dr. Patrick Bolt. Dr. Bolt is a board-certified orthopedic surgeon, and he deals with problems with herniated discs every day. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about early recognition of signs of a stroke and what to do about it. And also, the aortic valve, a special valve for the heart. When it causes trouble, what kind of trouble can you look for? A lot of information for you. You'll want to stay tuned. We're talking with Dr. Patrick Bolt, board-certified orthopedic surgeon, and we're going to be talking about back problems, disc problems, problems with the vertebra, what causes low back pain or even neck pain. Patrick, welcome to the Dr. Bob Show.
Thank you, glad to be here.
How common is low back pain?
It's incredibly common. Almost everybody, 90%, will have an episode of severe back pain at some point in their life. Most of us, it'll be a self-limited episode where we can't tie our shoes for a week, something like that. Other people have more severe problems on a daily basis.
You know, I've had problem on one occasion. My brother's had a problem. Have you had problems on one occasion?
Absolutely. The not being able to tie my shoes was from personal experience.
Yeah, and so it can really cause problems. When does it become a just inconvenience like it was to you and me, and more of a chronic issue? What's the problem?
If you have back pain that goes on and on for weeks on end, it's probably time to see a healthcare provider. Usually supportive care will be provided, something like anti-inflammatories, Tylenol, stretching exercises. If it keeps going or it starts affecting the neurologic structures, that's probably time to get a consultation.
Now, the neurologic structures, what are you talking about from that standpoint?
Well, most of the nerves run from your brain down the spinal column to the arms and legs.
And they're protected by the vertebra, bones there?
Yes, sir. They have, the vertebrae is in the front, and there's discs between the vertebrae which act as gaskets. And then there are joints behind the spinal column which allow you to bend backwards.
So the problem is that creates pain is what? If I scratch my leg, then pain goes up into my spinal column. Is it a certain part of the spinal column that it goes to?
Well, it runs up your leg, usually up the sciatic nerve, and then into the spine itself, and then up into the spinal cord where it goes to your brain, where you perceive the pain in your brain.
And then the brain says, hey, be careful.
Yeah.
Now, why is there muscle spasm associated with the pain from a herniated disc?
It's a good question. I described the disc pain as being separate from the muscle pain, and it acts almost like a seesaw. The disc pain hurts. You react to that pain by trying to splint your back, and you stiffen up. And if you walk around in a stiff posture for a good portion of the day, you're going to start to have muscle spasm, which is actually a secondary problem to the disc problem. And then you have to treat that problem in addition to it. And then the disc starts to hurt, and then the muscles start to hurt. You sit down, you stand up. It's a classic problem.
It sounds like it's a real problem. Now tell me about the disc. When you say herniated disc, what is that? What is a disc like?
The disc is a shock absorber between the bones, and it has a tough outer shell or casing. I like to call it like a tire. Tough outer tread, and the inner surface is soft. That outer tread can tear, and that causes back pain. If it tears enough, the soft inner portion, which is under pressure, think like hydraulic fluid, it wants to leak out. That soft part comes out of the tire and it can press on nerves in the spinal column.
That's herniation. When
That's the herniation.
Comes out there. And it pushes on what?
Well, if it comes out into the front of the spine, it generally doesn't cause any problem at all. But if it goes backwards where the nerves are running, it can pinch a nerve.
So it pinches a nerve and that's what causes the pain. Are most of the herniations to the front or to the back where it causes pain?
I'd say most of the herniations actually, unfortunately, go towards the back where it causes pain because there are weak spots along the tread or annulus of the disc in that location.
Now, when we talk about the spine, we start in the neck and then go to the chest, the thoracic, and then we go into the lumbar and sacral. So, any of those worse than others to cause herniation?
Well, the cervical or neck and the lumbar, the low back, move the most. The thoracic spine moves, but it's protected by the rib cage. There are such things as thoracic herniations or other problems in the thoracic spine, but most commonly, disc herniations happen in the low back or in the neck.
If you have a herniation in the low back, how do you know if it's causing serious problems, or what does serious problems really mean?
Well, if it's your back,
It's serious.
pain is serious. But what we worry about is when people start having neurologic or nerve problems. If you start having numbness, tingling, or loss of function in your legs or in your arms, it's time to seek medical help.
So the herniated disc in the low back can cause sensations down the leg, usually any certain part of the leg?
Well, the most common part would be the back of the thigh, the back of the calf, which is called the sacral 1 or S1 dermatome, which is the pattern that it makes down the leg. The second most common is down the outside of the thigh and the outside of the calf. There are a lot of different nerves in your spine, and if any one of them is pinched, it can cause its own pattern of pain, but those two are the most common.
Can you tell on physical exam pretty much which vertebra is involved, if it's the second or the third or the fourth? Or
I would say that most of the time a good physical exam can narrow it down to one or two vertebrae. We really like our MRI scans because they help us pinpoint it exactly, but on a good physical exam, if I raise my leg out straight like this, or if I bring it out like that, straight out from a seated position or from a lying down position, that tensions that nerve, and it gives me a clue when you say ouch, that nerve is under tension in your back.
now you mentioned MRI. Is that a lot better than a CAT scan or than just a regular x-ray of the back? What does an MRI really tell you?
Well, x-rays show the bones in high detail, and a CAT scan is a series of x-rays that give us a lot of information about the bony structure. It doesn't show the nerves or the discs very well. So we rely very heavily on the magnetic resonance imaging, or MRI, which shows discs and nerves in high detail.
Do you usually have just one disc involved, or is it frequent that you have two or three and you have to decide which is worse? What do you do?
Well, you've hit upon one of the biggest problems that plagues us as spine treatment physicians. The typical arthritis or aging spine will get multiple discs because when we wear and tear, when we play football or surf in the ocean or sit for prolonged periods of time in front of a computer, whatever we're doing, we wear and tear our spines all in one unit. That wear and tear happens at multiple discs together. If you herniate a disc, which can happen in a sudden motion or sudden movement, that usually is at one location.
Is treatment usually a 2-week treatment, or it's hard to tell, or you can tell more? How do you decide how to treat that patient?
The good news is that 90% of herniated disc pain will start getting better within 6 to 12 weeks. So even if you have a herniated disc, it's not the end of the world. Most of the time it will start to get better on its own or with some simple, straightforward treatment.
Do you have special things to tell people, like the type of mattress, the type of position, about physical therapy, about muscle relaxants, about pain medications?
Absolutely.
And that's what we're going to be talking about when we come back. If you have a herniated disc, if you've got pain, what is the treatment? And if it doesn't work, What are the types of surgery that are available for you? You'll want to stay tuned. We're talking with Dr. Patrick Bolt, and we're talking about herniated disc and how they can cause nerve pain, how the MRI gives the best information about what's going on with the disc and what kind of problems it's causing. And now we're talking about treatment. And you mentioned briefly treatment, but let's say I'm a 50-year-old that have had 5 or 6 episodes of low back pain, and I come in and we get an MRI and I've got a herniated disc and my back is hurting me and I've got spasm. What are you going to tell me to do?
Well, the very first thing that we're going to try to find out, are you having predominantly back pain or is there a large element of nerve pain? We really treat those two things a little bit differently. In the instance of back pain, we're going to stress anti-inflammatories, keeping your weight down, stopping smoking, and then physical therapy.
Is there a position, you hear about a hard bed or a hard mattress. Is it just get in the position that's best for you, or is the type of mattress help?
Well, I back away from that question a lot of times. The very first time that I had a patient ask me that, I made a recommendation on a mattress. They bought that mattress and didn't like it. So in general, a firm mattress tends to be more supportive of the spine, but my recommendation is go with what's comfortable for you and helps you get a good night's rest.
Are there positions it's better to sleep on the side with your legs tucked up, or do you extend out, or it's whatever helps you?
Whatever helps you, but if you're having a lot of back pain, low back pain, many people find that sleeping with a pillow between their legs or sleeping with a pillow underneath their knees, if they're back sleepers, helps relax those muscles that are tired after guarding that disc all day.
You see some people in some companies that wear belts on their back to protect their back. Are those helpful?
The science says no. However, I will tell you what the scientists were asking was, does it prevent injuries? Does it quicken your recovery from a back pain episode? In large, it doesn't. However, I have many patients who really find a lot of comfort with some sort of support. I caution them to only use it occasionally. We don't want it to become a crutch that they use all the time because that actually weakens the core muscles.
Now, I want to walk into surgery. I want to know what is available for people, and so I want to talk about nerve pain versus back pain, because apparently there's a big difference in what you do with those.
There is. If you're having a lot of nerve pain and your MRI shows that you have a nerve that is compressed or is pinched.
Now, give me an example of nerve pain.
Pain running down your leg.
Okay.
So if you're having a lot of back pain and a lot of pain running down your leg and your MRI shows a pinched nerve, you might be a candidate for surgery.
How about, I hear people say their buttocks hurts. They've just got pain in the buttocks and low back pain, and then sometimes it goes down the back of the leg. Is there any key to the buttocks hurting?
The buttocks pain generally refers to sciatica or pain in the sciatic nerve, and usually that's an indicator of nerve pain.
Okay, and then so how's the nerve pain treated?
Well, if you have a pinched nerve, if there's a nerve that's compressed, then relieving the compression can relieve the nerve pain. And this is one of our most popular surgeries. It is one of the most effective surgeries that we have to offer, relieving the pressure on a pinched nerve.
So in general, how do you relieve that pressure? You said it's like a tire. You've got the outside, sometimes it's torn on the outside, the disc begins to penetrate through. Where is the surgery done in that?
Well, the surgery approaches the nerve, and it'll see bone first, and the surgeon will take maybe a small portion of bone with a small drill, and then the nerve and the disc will be seen. And usually the nerve is overlying the disc, and the disc is pinching the nerve. We slide the nerve off to the side, take the piece of disc away that's pinching the nerve, and then generally the nerve is much happier.
When you take the disc away, do you cut it off, throw it away? Do you push it back in? What do you do with it?
Well, a lot of things have been tried over the years, and the most effective is to simply remove it.
So that's called a
Discectomy.
discectomy. Is that common?
It's actually a very common procedure. It's probably one of the most common spine surgeries performed in the world.
And if somebody is having nerve pain because of the disc that's herniated, you remove the disc. Sounds to me like pain goes away and you live happily ever after.
The pain does go away about 90% of the time. The 10% where pain might not go away, there might be It might be that the disc has been pressing on the nerve too long and there's some element of nerve damage, or it might be that there's something else causing the pain. But 9 out of 10 times, people will feel relief from a discectomy if they have nerve pain from a pinched nerve.
Now, I hear the words minimally invasive for back surgery. What does that mean?
Well, minimally invasive is a very complicated term because it's been used in a lot of marketing. However, there's some real stuff to it. There's a real bulk to it. The minimally invasive movement started when spine surgery became more popular, more spine surgeries were being done, and surgeons started asking themselves, how can we do this exact same surgery through a smaller incision and create less trauma to the patient? A lot of the bad reputation from spine surgery comes from the disruption of the muscles in the back. These same muscles that we were talking about spasming.
Yeah.
You have to go through them or around them in some sort of way to get to the spine. The smaller the incision that you can make to go through there, the less pain and suffering the patient would have post-surgically.
In the past, did you have to cut that muscle in order to get to the disc that was there, or you just push it aside?
They generally did cut through the muscle in the past, and before MRIs, they would make a large incision up and down the spine and look at each disc to try to find the herniated one. Obviously, that was a big surgery. Once we've had MRIs, we can go directly to the disc that we know is the problem, make a much smaller incision, and only see what we need to see.
So recovery time is a big part of minimally invasive surgery, where you can bypass the muscle in a way.
Yes.
Tell me about the neck versus the back. Is it more difficult? Is it easier? Is it the same problems? You got the same disc, same vertebra?
Many of the same problems exist in the neck that exist in the back, herniated disc being one of them. Another concept is spinal stenosis, which is basically bone spurs growing into the nerves rather than a disc. It produces many of the same problems, which is neck pain, pain running into the arms, and many of the treatments are the same: physical therapy, injection therapy, surgery.
How do you decide when the patient needs surgery? You know, I've been very, very impressed that the back surgeons do everything they can to keep from doing surgery, but sometimes you got to do it. How do you decide?
Surgery is what we frequently call a last resort, not because it's ineffective, but because many non-surgical treatments will produce a similar outcome. However, when we have to do surgery or we need to do surgery, what we find is if someone has a progressive neurological deficit, and what that means is their nerves are getting weaker and weaker as time progresses, that person needs surgery sooner rather than later. Another thing, the nerves that control your bowel and your bladder also pass through the spine. If those nerves aren't working, you need to seek emergency treatment. That needs surgery sooner rather than later. The other type of person that needs surgery is someone who's not getting better with physical therapy, injections, time. Every effort's been made and they still are having a lot of nerve pain. That person probably would benefit from surgery.
Results pretty good from surgery if somebody, it's a devastating problem. It's a common cause of disability, low back pain. Surgery do pretty good.
I would say that 85 to 90% of people who come for a disc surgery end up appreciating the fact that they had surgery in a properly selected patient population.
Sure. Patrick Bolt, thank you for coming to the Dr. Bob Show. It's really great information to know how we approach herniated discs medically, and then if that is not good enough, we can end up having to have surgery that's effective. Thank you for coming to teach us.
Thank you for having me.
I hope I don't get back pain again, but if I do, I know it's treatable. And now you'll want to stay tuned. We're going to be talking about early recognition of signs of stroke and also the aortic valve. What does that mean and what happens if it goes wrong? It's a heart valve and it can cause trouble. Almost everybody is going to have low back pain at some time, so what do we do for it? You know, do we need to go see our doctor for it? Do we need to start taking medications for it? Do we see a chiropractor? Do we see somebody with acupuncture? What do we do if we get recurrent low back pain? Well, there have been so many studies that have been done, and if you've got an acute strain, what you want to do is you don't have to have a hard mattress. You get in a position in your bed that's comfortable. You listen to your body. If it says be really careful when you get up, be careful when you get up. Don't do exercise. Start using an anti-inflammatory medicine, ibuprofen. Be careful about your stomach. Everybody knows that there's no free lunch, so if you take an anti-inflammatory medication, then be sure that it doesn't cause you tummy problem. But get more rest, get in the position that's most comfortable for you. Sometimes muscle relaxants will help. You know, when you get low back pain, the muscles go into spasm and they pull down on that vertebra even more and cause more irritation to the nerve root that's coming out. So muscle relaxants, anti-inflammatory, rest, listen to your body. Know that if you do that, most pain will go away in 5 to 7 days. If it doesn't, have to see your doctor. He may guide you with physical therapy, get the proper x-rays, but be sure that you know if you've got chronic back pain, most common cause of disability, need to see a doctor for that and let him guide you toward good health. I want to thank Dr. Patrick Bolt. Wonderful discussion on herniated discs and what can be done for them. And now for questions from you, the viewer, that I think will be important to your health. Dr. Bob, I always hear about the importance of early recognition of signs of a stroke. What are they? Well, it's an excellent question. If there's anything going wrong with the way you're functioning, you should think of, is it a stroke? But there is an acronym, FAST, F-A-S-T. F is face. If you've got asymmetry of the face, if you've got drooling on one side of the face, drooping on one side of the face, that's an early sign of stroke. The arms, if you can't raise your arm or if your arm or your leg is weak, that's the second time. The S for under fast is your speech. If you suddenly got slurred speech, if you can't say the words that you want to say, it could be a sign of stroke. If you've got sudden loss of vision in one eye, if you've got sudden numbness on one side of the body or one side of the face that's there, you must think about early signs of stroke, because that's the F-A-S-T, that's time. If you recognize stroke early and get to the emergency room, the doctor can decide the kind of treatment that can keep that stroke from progressing and can maybe make it where you have total recovery. And so what happens when you go to the emergency room? They'll decide if the stroke is from a burst vessel that's bleeding or if it's because a vessel is closed off. If it's closed off, we can open it up. If a blood vessel is burst and you give medicine to keep it open, you may cause bleeding that causes death. So to the emergency room rapidly if you have any problems suggestive of stroke. Question number 2. My doctor says I've got aortic valve disease. What does that mean? Well, the big pump from the heart, the left ventricle, pumps blood out through the aortic valve. If that valve has problems, it can actually keep the blood from coming out easily. That's called aortic stenosis. It's usually if there's calcium in that valve or that valve has been made where it's scarred down. And we call that aortic stenosis. The blood has a hard time getting out, so the blood pressure becomes low and people get short of breath very easily, and sometimes will lose consciousness because as they get active, the heart can't pump out enough blood. Exactly the other problem. What if we have aortic insufficiency? And that's where when blood goes out through the aortic valve and the heart rests, the blood tries to come back in. It's stopped by the aortic valve. There are 3 buckets, we'll call them, that come together and they keep the blood from coming back into the heart. If that doesn't occur and you've got some blood that comes back into the heart, then you've got the normal volume plus extra volume and the heart pushes out huge amounts of blood. That's called aortic insufficiency. That can be due to a bicuspid valve. Instead of 3 buckets, there's only 2, and a bicuspid aortic valve can cause aortic insufficiency. The heart can enlarge, people can become short of breath, their feet swell, They have exercise intolerance. So if your feet swell and you're short of breath and you've got chest discomfort, think about your heart, talk to your doctor about it. If it's aortic valve disease, they can measure what's going on and they can decide if it needs to get fixed. There are new types of surgery to fix the aortic valve. It's not like it was in the old days. If you've got heart valve problems, know that you need careful and thorough and repeated follow-up with your heart specialist. That's all the time that we have for this show. I hope you've enjoyed it as much as I have. Remember the things that we like to do. They're so important. Number one is regular exercise. Don't worry about what kind of exercise. Just make sure that you pick a time of the day, and every day you go out, hopefully with a friend, and you exercise, fast walking, running, jogging, bicycling, swimming, climbing mountains, working in the garden. Anything you do is going to be good. But make it 30, 40, 60 minutes every day. Eat properly. We all know how to eat. We know we need to be eating more fruits and more vegetables, less fried fatty foods, less volume of foods. Enjoy the food that you eat, but don't eat so much of it. 8 hours of sleep, and it's got to be quality sleep. If you've got something that's keeping you from sleeping well, you need to talk to your doctor about it. And what is it that we like in the Dr. Bob Show the most? It's that laughter in your life. Find somebody that you laugh with, have fun, enjoy yourself, and your laughter will make you healthy.